The inspection, according to the committee, was partly inspired by the reported surge in COVID-19 cases at the Kotoka International Airport weeks ago. The committee members, who had the opportunity to interrogate authorities, indicated that they were generally satisfied with the process despite having some reservations.
The processes is impressive, and when I say it is impressive, it is the processes that they have taken us through from the beginning, the operational processes, from the beginning to the end, where you take your luggage and then exit. Per what we have seen, I think that we are impressive, but there are yet some other discussions, outstanding issues that will clear from, those who take the policymakers.
The committee members were taken through the process of COVID-19 testing by the Managing Director of the Ghana Airport Company Limited and the Director General of the Ghana Health Service. The ranking member on the Health Committee, Kwabena Minta Kando, raised issues with part of the process. At the end of the tour, the members of parliament were concerned as to whether the daily numbers of COVID-19 cases were on the rise, as was earlier reported.
I have one or two reservations. For example, how the port officials come into contact with the passengers before the passengers know whether or not they are positive. That's a worry, and I believe from here we'll have some interactions with them, and then we'll ponder over it how we can adequately resolve that one. And then we are yet to also find out whether or not the reported cases are declining or increasing.
Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, however, assured that the numbers had since reduced.
The current situation is that the numbers have come back to pre-surge numbers. Sometimes it's 2, 1, 4, thereabout, after testing about 1,000 or so people. But also the system tells you that when there's a surge in countries, when we had a surge, that was when we had the Indian and Dubai prevalence, increases in prevalence. As soon as airlines stopped going to India, it also reflected in our numbers here. And so it tells you that the system is picking the numbers as they come in.
The minority in parliament has, since the commencement of testing at the airport, raised concerns about the cost, but the committee observed that the cost had been reduced to $50. Ranking member on the committee, Kwabena Minta Kando, wants a further reduction.
There were a lot of hula balloos about the cost, the price, and now we are told that it's been reduced to about $50 for now. It used to be about $150. So these are the issues we picked from the people, and so we'll follow every bit of it. We wish we could go further down, so it will be part of our discussion after here. They're just taking us through the processes, and if they could reduce it to 50, why didn't they do it earlier on? So these are all questions we'll find out from them. But immediately after going through the procedure, we have come to engage you. So from here, we'll engage them further and then understand from their point of view.
The committee has agreed to engage the Ministry of Health on some policy issues observed during the inspection exercise.